Good morning, everyone. Thank you for joining us. I acknowledge that we are gathered on the territory of the signatories of Treaty 7, and I recognize the Métis people of Alberta who share a deep connection with this land. I'm Lori Sigurdson, the Alberta NDP Critic for Seniors Issues, Continuing Care and Home Care. And I'm joined today by my colleague Janet Eremenko, the Alberta NDP Critic for Mental Health and Addiction, and three advocates for residents of the Care West Colonel Belcher Long-Term Care Facility, Anne Sorby, Lisa Johnson, and retired Colonel Charles Hamill, who you will be hearing from very shortly. I would also like to thank everyone who is joining us today to show their support for this very important issue. In January 2021, when COVID cases were high and over 1,000 Albertans were in the hospital because of it, the UCP government began placing people over the age of 18 with complex mental health issues into long-term care facilities to try to alleviate some of the strain on hospitals during this spike. At that time, 29 patients were placed at the Care West Colonel Belcher as part of this trial program. This was to be a temporary measure and would be subject to a review and a risk assessment. However, the UCP never completed that study. So, as of today, the complex mental health program has 58 patients placed in the 175-bed seniors facility. Some of these patients are high risk. This temporary measure has created a stressful and unsafe environment for all residents, staff, and visitors at the Care West Colonel Belcher. It is unfortunately not uncommon for a code white to be declared at the long-term care facility, indicating an aggressive, violent situation is in process. Examples of such distressing incidents that have happened at the Care West Colonel Belcher include a complex mental health patient choking a 100-year-old veteran. And just a couple weeks ago, an unsecured and unmonitored complex mental health patient was being verbally abusive and behaving in such a disturbing manner, staff had to barricade themselves in a second-floor kitchen area and call security for help. A few days later, the same patient entered the first-floor reception area of the Care West Colonel Belcher, caused a substantial disturbance, and damaged the area. Although there is a security guard at the facility, the Calgary Police Service is routinely called in to deal with these extremely challenging situations, and residents must often shelter in their rooms until the situation is resolved. A concerned family member of Care West Colonel Belcher resident recently accessed police reports through a Freedom of Information request and learned that the Calgary Police Service had been dispatched to the facility 56 times in the last 12-month period. No one should have to live in fear in their own home. Some of the most vulnerable seniors, many of whom spent time in military service for our country, should most definitely not spend their remaining years in unsafe conditions. Complex mental health patients must also be treated with compassion and dignity. They deserve the health care and programs that meet their needs. But it is clear that this temporary measure, which seems to have become permanent at the Care West Colonel Belcher, is failing both groups of residents. I wrote a letter to Minister Nixon in October urging him to look into this issue. I still have not heard back from him. I'd now like to invite Anne Sorby to the mic. Anne?
Thank you. Thank you, Lori. My father used to live at Care West Colonel Belcher, but we removed him in November 2022 for his own safety. He was assaulted twice while living there. So when his memory care unit was to become one of the locked units onto which folks over the age of 18 with complex mental health challenges were to be admitted, my family felt we had no choice but to move him at great personal cost into private care. I've remained involved with Care West Colonel Belcher because I believe the safety and well-being of all residents, staff, and visitors are at risk at this facility. But we are also here today because we're concerned for anyone living in long-term care in Alberta. This ad hoc program that began here as a temporary measure during the pandemic can and most likely will be implemented in long-term care centers across the province, if that hasn't been done already. This is a program that was implemented without any evidence-based support. And despite numerous requests, we have not been provided with details of the policy directive and guidance or the implementation plan. The UCP government's new Continuing Care Act, which came into effect April 1st, clearly demonstrates that the best interests of frail and vulnerable Albertans are not the focus of this government. I won't get into everything that's wrong with the Act because that would be a whole other press conference and many people have already spoken up. But what is very concerning for us is that during a virtual public overview of the new Continuing Care legislation framework provided by Alberta Health on April 3rd, it was confirmed that the new normal will see long-term care centers for senior residents being replaced by continuing care homes and include complex mental health patients. The rationale is that the complex mental health program is now a long-term care program, much like the dementia program, which is embedded in long-term care centers. We're all here to tell you that the complex mental health program in place at Care West Colonel Belcher is not working, and it should not be replicated in any facility that is home to a fragile, vulnerable senior population. The devastating truth is that as long as Alberta Health doesn't recognize how grave the situation is with this temporary measure, which has gone horribly wrong at the expense of all the residents here, it will be allowed to continue and be implemented in any long-term care center. The commingled living situation here is not working. And because of the harm that's being caused, I believe that advocating for all the residents who are essentially disenfranchised is absolutely critical. Thank you.
Thank you, Anne. And I'd now like to call Lisa Johnson to the mic. Lisa?
Thank you, Lori. I am the primary caregiver for my father, Curtis Johnson, who was a private in the Army and served overseas. We were not told about the complex mental health program prior to placing my father here. Because of the stress this situation is having on my father, who already has complex PTSD, we have been left with no other choice but to put him on a wait list to move him if things do not change. I am also the chair of the Resident and Family Council. A number of our meetings have been dominated by the concerns families and residents have regarding the commingling of our long-term care residents and the complex mental health patients. As chair, I am here to speak on behalf of families and residents who are fearful to speak up due to concerns about retaliation. This current living situation has caused residents, especially the frail long-term residents, to be fearful for their safety, and many are choosing to stay in their rooms alone and are no longer moving freely around the facility as they did in the past. Other residents do not want to take part in activities anymore. This situation does not provide a good quality of life for both the complex mental health patients and our long-term care residents. The practicing of commingling the two groups is not working, and it hasn't since the first admissions in 2021. All Care West Colonel Belcher residents have the right to feel safe in their homes. Thank you.
Thank you, Lisa. And now I'd like to invite Charles Hamill to the mic. Charles?
Thank you, Lori, and good morning, everyone. I am the board chair for the Friends of Colonel Belcher Society. We are a non-for-profit society, and along with Vets Angels, our mandates are to enhance the quality of life of our veteran residents at Care West Colonel Belcher. And as a veteran myself, I am always advocating for their welfare. This beautiful long-term care residence was purpose-built for veterans with the generosity of the Calgary community in 2003 and perpetuates its illustrious history dating back to 1919 when the Colonel Belcher Hospital opened its doors to care for wounded soldiers returning from the Great War. Before the start of the pandemic, Care West Colonel Belcher was considered one of the premier long-term care centers for veterans in Canada. Regrettably, we can no longer recommend this facility to anyone considering sending their loved ones to Care West Colonel Belcher due to the unsafe conditions directly attributed to the complex mental health program which started in 2021. Along with my colleagues, our advocacy efforts began with a meeting with the former Alberta Minister of Health, Jason Copping, in October 2022. The salient outcomes of this meeting were that the minister recognized that the complex mental health patients and the long-term care residents cohorts were not homogeneous, and due to the potential risk, he was adamant that there should be no commingling. He was further surprised that the Care West Colonel Belcher was selected as a suitable site since it could not be compliant in keeping the groups separate, and that it included vulnerable veterans who were likely coping with operational stress injuries such as post-traumatic stress disorder. Mr. Copping lost his seat in the recent provincial election, and his direction and guidance have been ignored by his successor, Alberta Health, Alberta Health Services, the Care West Executive, and the Care West Colonel Belcher Management. In spite of our best advocacy efforts and engagement with Care West over the past 2 years, we have been stonewalled. We are therefore grateful to the Alberta NDP caucus for being proactive in supporting our cause to ensure that veteran and community long-term care residents can once again enjoy their final home safely and peacefully. Equally important is that complex mental health patients should live in a facility where staff can focus on offering the appropriate care and programs to give them opportunity to be supported and live with dignity. And finally, that the public is rightfully informed of this ad hoc initiative that will impact all Albertans. I conclude my remarks with the following question. Would you like to see your parent or grandparent live the last days of their life in constant fear in the place they call home? Thank you.
Thank you, Chuck, Anne, and Lisa, for your dedicated advocacy on behalf of both seniors and mental health residents, families, and staff of the Care West Colonel Belcher. Compared to the Canadian average, Alberta has less than half the psychiatric acute care beds per 100,000 people. Where the national average is 30, Alberta's rate is just 13. Clearly, the UCP government knows that there is a shortage of mental health spaces in the province. It's why they're placing patients in facilities that are not built nor staffed to the necessary level. This has a significant impact on Albertans with complex mental health challenges and on their families. Psychiatric care is not geriatric care, and vice versa. Staff at long-term care centers are not equipped or specialized to meet these diverse care needs, nor is the facility. Rather than address the shortfalls of the mental health system by stepping up with improvements and more spaces, the UCP government is cutting corners. They are shuffling people about without consideration of their healthcare requirements or supportive housing needs. Today, we are calling for a stop order to be issued to prevent any further admission of complex mental health patients to long-term care facilities until a comprehensive and transparent review and risk assessment is completed. This is something that was promised during the trial period, but to date has never been done. This transparent review and risk assessment should also include looking into the psychological impact on residents, families, and staff. who have endured these challenging circumstances with very little help from the current health minister. I want to stress that people with complex mental health concerns face enough stigma as it is and are far more likely to be the victims of violence than to be perpetrators. When we deliver skilled, compassionate care in the right setting, people living with complex mental health concerns can thrive. After all, isn't that what Alberta's recovery model is supposed to do? It's clear that the Care West Colonel Belcher facility is not equipped to deliver an appropriate level of care to these two very different patient cohorts. This temporary measure to co-locate vulnerable seniors with complex mental health patients is not a sustainable solution. Everyone deserves a safe place to live and the necessary care to live their life in dignity and to their fullest. Thank you so much, and we are happy to take your questions.
All right, thank you. Also, we will now go to questions. Just a reminder for those joining us on the phone lines to use *9, and for those joining us on Zoom to use the raise hand function to get into the question queue. We will first start with questions in the room. Okay, we'll go to the phone lines. Catherine, your line is open.
I'm wondering what should happen to the complex mental health patients. Like, is there space for them to go somewhere else right now? Like, where should they go?
Yeah, thanks, Catherine. It's a really good question. So there are currently kind of three categories within Alberta Health Services that we can talk about. One is around community mental health, which is kind of permanent supportive housing out in the community. One are psychiatric acute care beds that are actually happening within units in hospitals across the province. And then there are others such as Clare's home care facilities that have a more robust kind of support and security system in place. You know, without a doubt, all of those factors require some significant investment. As I mentioned, when we look at the actual rate of acute care beds for adults in the province, we are woefully inadequate. When it comes to psychiatric health care, that has often been forgotten, and unfortunately, this continues to be the case. And so it is not a quick solution. I certainly recognize that. Whatever the solution may be, it needs to be appropriately resourced, and that is exactly why here we're asking for a stop to the current practice to fully assess and analyze what has happened in the current system that all of these wonderful validators are here to confirm. And that if it is in fact a path that this government chooses to move forward on, that it needs to be resourced appropriately, that it needs to be intentional, and that it needs to be done with the full level of specialization that recognizes the unique care needs of both of these groups. Not a quick solution, I recognize, but the investments have got to start now, and I think what we've established here today is that the current practice that began in 2021 and before is not one to be normalized without a serious reconsideration of the resourcing and impact that it has on everybody involved.
Do you have a follow-up, Catherine?
Yeah, and it sounded like the former health minister, Jason Coffin, was sort of open to hearing these concerns. I'm wondering what, if any, conversations, that this government has had with this group.
I'll hand that over to my colleague, Lori.
Yeah, for sure. And I would like, I wasn't part of those initial conversations with Minister Copping, so I'd like to actually get Anne to say more clearly what he did say.
Thanks, Lori. Now, I met with Minister Copping along with Charles Amell, and he was very clear about the understood guidelines that would, focus the program. And what he said specifically was that these two very different groups of people with very different needs were not to be commingled in the same building or in the same units, which is something that has been happening here, and sadly resulting in a lot of fallout and harm. Charles, is there anything you wanted to?
Sure, that's good. Okay. Yeah, thanks, Anne. And I just want to say that I did reach out to Minister Nixon. Of course, he's the Minister of Seniors, and asked, and I wrote him a letter and about this issue that we're talking about, of course, and have not heard back, and that was several months ago. So this government really is, certainly when we challenge them about some of this, it's mostly everything's going fine and not really willing to look at things and even respond to us in terms of the letter that I wrote to Minister Nixon.
All right, we'll go to the next question. Please state your name and outlet. Natasha, your line is open. Natasha, your line is open. All right, we unfortunately can't hear you, Natasha. We will follow up with you for your question. We'll do another pass for questions in the room. All right, and with that, that concludes our press conference. Thanks, folks.
Yes, thank you, everyone. Well done.